Hey everybody, my name's Ginger. I'm the dietitian here at the bariatric clinic. And we've got some on so far. So if you cannot hear me or can't see me, just kind of respond in the chat message and just let us know. And we'll try to fix that for you. So tonight's a little different. Usually for our support group in December, we all come together and we do kind of like a cooking demo about good quality food choices for the holidays. But unfortunately, COVID has kind of wrecked that. So I kind of thought there's really no reason for me to cook food, right? You can't taste it. We can't participate together. So we kind of did a regroup for this one, and we thought we would kind of talk about just good nutrition in general, whether it is the holidays, whether it is going out to eat, or buying from the grocery store. So that is what we're going to talk about tonight. So if you ever have any questions during this talk, please also comment and we will answer any and all questions for you. It is Vivian and I here tonight, so we can answer nutrition questions, nursing questions, we can answer surgery questions. So we can pretty much do the whole gamut. So let's get started. I know a lot of y'all that attend our support groups, or the majority, I should say, are pre-surgery. So let me first off kind of explain to you about this journey. This is not going to be a diet that you're going to follow for the rest of your life. This is truly a lifestyle change. And when we think about lifestyle changes, we think about habits. We don't make habits overnight. We're not going to change them overnight. And so now is really the time pre-surgery to kind of start thinking through that. The first thing we have to do is just be mindful of not how us as individuals eat, but really how our culture eats here in America. We eat a lot of carbs. Everything has carbs in it. And so sometimes when we go to the grocery store, we don't know how to read the food labels, or we go out to eat, we really don't understand what we should be choosing and what we shouldn't be choosing. So let's start at the grocery store. It's real simple. We're going to look at food labels, okay? Let me get my little sample of a food label. So I have these Quest bars, protein bars, because if you ever have been in the grocery store and looked for protein bars, or you've gone to a convenience store and you're saying, okay, I'm going to get a protein bar. A lot of them are extremely high in carbs, total grams of carb, okay? And so just because they have 20 grams of protein, they might have 60 grams of carbs in them. That's still not a good choice. So the reason I do like, if we're going to choose a protein bar, I like the Quest, is if you look at the serving size, of course, it's one bar, okay? You look at the gram of proteins and it's 21 grams of protein, which is that's about a 3-ounce portion of protein, because 1 ounce of protein equals 7 grams every time when you look at it, okay? Then I'm going to look at total grams of carbohydrate. So this is 21 grams of carbohydrate. My kind of rule of thumb is I always want the grams of protein to be higher than grams of carbs, okay? However, you can subtract the number of dietary fiber grams from your total carbohydrates. Your body doesn't really digest that as true sugar, and it doesn't absorb it. So even though I've not had the surgery, I do have type 1 diabetes. So I know what it's all about reading carbs and reading labels and what do I choose and what do I not choose. So for me, just for instance, I can subtract the 14 grams of fiber from the 21 grams. So it's really a total of 7 grams of carb. Okay? We're not going to subtract the sugars or the sugar alcohols or anything like that. It is just total grams of carb, and you can subtract the fiber from it, and that lowers your total grams of carb. So for this, so just saying, since I have diabetes, 21 grams of carb, I would normally take like 1.5 units of insulin for that, for 21 grams. However, if I take 21 grams from this, or I'm sorry, if I take 1.5 units of insulin for this, my blood sugar is going to drop. So that's why I subtract the fiber from it. So I would only take about 0.5 unit for this. So simple rules. You are always going to look at serving size. You are always going to look at grams of protein. And you always want the grams of protein on any food, anything you choose, to be higher than the grams of total carbohydrates. Okay? So that's how you read the food labels now. However, when you go out to eat, food labels aren't on the food. So we kind of have to know the different food groups. We have to know what counts as a protein. If it walks, if it runs, if it flies, if it swims, it's a protein. Okay? We have to know what our non-starchy vegetables are, because they're not going to give us any carbs or very much. And we have to know what our carbs are. Okay? Carbs are anything that's going to change to sugar. Whether it's good, bad, ugly, beautiful, does not matter. Okay? Just because it's real sugar or trying to think of other words people use. Natural, I guess you could say. It's still going to change to sugar in your body. So we have to be very careful. We have to know what counts as a carb, and we have to know our proteins and our non-starchy vegetables. So I printed off some menus from places around Tupelo. One of the easy things, and I'll show you. So we've come up with our bariatric plates, and everybody gets these at their 6-week visit post-op. So when you have surgery, you will come back about 2 weeks after you have your surgery to see me and your surgeon. And then you will also come back at 6 weeks after surgery. After that, or at that, I'm sorry, I'm trying to get it so you can see it. At that appointment, I'm going to give you this plate and I'm going to explain it to you. Okay? The most important thing that you eat after surgery is 60 to 70 grams of protein. You're going to hear that so many times, you're going to dream it and be able to say it in your dreams. So we're going to eat in order, or order in order. Okay, so we're always going to choose and eat those proteins first. Then we're going to choose and eat our non-starchy vegetables. And then we're going to choose and eat our good carbs. So let's kind of go over that. I've already told you your proteins, if it walks, if it runs, if it flies, if it swims. You can bake, you can broil, you can roast, you can grill, you can steam, you can boil, you can even air fry, as long as you don't put the breading on it. So you don't want to order anything fried out, because it's not necessarily the fried part, it's the breading that they fry. And any type of flour, does not matter what kind of flour it is, any type, or cornmeal or anything like that, is going to change to sugar, because all it is carbs. So I have one question. How many Quest bars can you have in a day? I would not go over more than one, and I really wouldn't do them every day. Maybe once or twice a week. So let me kind of start there. This is, or I would like for everybody to eat real food. I would like for you to get your protein from real protein, not protein bars, protein supplements for the rest of your life. That is not a lifestyle change. And there is not one restaurant out there that has protein supplements or protein bars on their menu. So you have to be able to order good quality foods. Okay, but now we can incorporate those Quest bars here and there, which is all fine in moderation. So let's say we're going to go out to eat to a Mexican restaurant. Well, how in the world and what in the world am I going to order? And I was going to print off one of the menus, but have y'all ever been to a Mexican restaurant and tried to look at the menu? There's about 500 items on there. So these are the general rules. I'm a big chip, guacamole, cheese dip person. I have to tell them, do not bring chips to my table. Okay? Just don't bring them. Because if they bring them, I'm going to eat them. So I don't want to be tempted. So you just very nicely ask them, please don't bring the chips to my table. So if you go in, you're first going to look at the proteins. It can be chicken, it can be beef, it can be shrimp. And you're going to order whichever protein that you want. That's where you're going to go. And so I'm always going to get probably shrimp. That's probably my first go-to. Then you can see, okay, what kind of shrimp dishes do they have? You can have the cheese dip. You can have the guacamole. You can have the salsa. So I'm going to choose shrimp, and my next choice is going to be those non-starchy vegetables. So look at the fajitas. It's a beef, chicken, or shrimp fajita. The fajita part, the inside part, is going to be non-starchy vegetables, onions. You're going to get green peppers, okay? Maybe mushrooms. I'm going to tell them to hold the tortilla shells because it's pure carb, and I'm going to get a small serving of the refried beans, because beans are a good carb. They have a ton of fiber in them, so it lowers that amount of total carb. Got a little bit of protein in them too. So I'm going to also have the guacamole and the salsa and the cheese dip with it. So that would be how you can order, or a suggestion how you can order a Mexican restaurant. What if you're going to Chick-fil-A? Well, we want grilled chicken tenders. You can do the grilled chicken nuggets. A side item, whether you're at Abner's or Zaxby's or Chick-fil-A, get a side salad. You can have regular dressing as long as it's like an Italian-based dressing. Don't get Thousand Island. I can't get around it. It's just pure sugar. Okay. And then for a good carb, most all of them have like a side order of fruit, whether it's apples, oranges, kind of off the kids menu. Okay. And we're going to get to kids menu in just a minute. What if you're going to McDonald's or Wendy's? You know, you can always order a hamburger. You take the bun off. Okay. You can have the patty or a grilled chicken patty. You can have the lettuce, tomatoes. You can have a little bit of ketchup, pickles, mustard, mayonnaise. You can have all that. And a lot of the burger places now, I know especially Burger King, they have lettuce wrapped hamburgers now. So that's what you want to choose. And then like at Wendy's, you could choose that with a side of the small chili. Got beans in it, it's got meat in it. Or you could always do a grilled chicken salad wherever you are. So those are just some suggestions like fast food. But I printed off I want to say this is Red Lobster. No, I'm sorry. This is Olive Garden. So I printed off the menu to Olive Garden. And it is a lot of pasta, right? So what are we going to choose at a Olive Garden? Well, you know, you get the salad. You can have all the salad that you want. Tell them to hold the bread. Just don't tempt me to eat those breadsticks. Okay? Then you're going to kind of look at the proteins. Well, we've got everything right here on the classic entrees. All have pasta in them, so we're not going to choose that. Then a lot of people, especially when they've had bariatric surgery, they want to order off the kids menu because it's smaller portions. However, be very careful because if you go to any restaurant, anything kids menu is going to be fried or it's going to be pasta. Have you ever noticed that? It's either macaroni and cheese, fried chicken strips, or pasta with white sauce on it, or spaghetti and meatballs. You don't want to order off the kids menu, okay? None of it is healthy, honestly. So either share with your whoever you're eating with, or you take it for the next day, okay? So Olive Garden does have some chicken with marinara sauce on it. And it comes with like a side of broccoli. So you want to choose your chicken. It also has fish, so you could choose salmon with the side of steamed vegetables. Okay, and then the big salad. And I promise you, you're going to feel full because you are feeling yourself full of good nutrition. Okay, let's say we go to Applebee's. And we want appetizer, we want an entree, we want everything, okay? So the appetizers at Applebee's, I would either choose the boneless wings, and I think they have a shrimp cocktail. You could also do like the spinach and cheese dip. You just don't want to put it on the chips, okay? You can always order a steak. It comes with broccoli. I see green beans. You can do ribs. And if you're looking for a good carb, you don't want to choose the fries. You want to choose the real baked potato. Okay? So let's see. What about a steak in it? If I can, what size? Yes, steak is a protein. After surgery, I would choose the smallest one you can find. Okay, it's normally going to be a fillet, and it's going to be about a 6 or 8 ounce. After surgery, you have to get in 60 to 70 grams of protein, no matter what. No questions asked. Must, must, must. You are never going to be able to eat those 60 grams at one time. So, like I said earlier, 60 grams of protein basically looks like 9 ounces of meat. So, if you go out to eat and you order a steak, 6 ounces, you might be able to get a third of that down in one sitting, 2 ounces. Okay. And so you take the rest of it home with you. Whole wheat pasta. Is that okay? The thing I say about pastas and rice after surgery, or bread or crackers. Think about this. When we remove the majority of your stomach, we don't remove all the gastric juices that live in your stomach, okay? So you're still going to have, even in that small, small stomach, you're still going to have gastric juices there. So that's fluid. It's like water. So what happens when you put pasta in water, rice in water, crackers, bread in water? It swells, right? And so when you put that in on your stomach, it's going to swell. And a lot of times what happens is that hurts you. So I always suggest you choose like the spiral zucchini or the spiral cauliflower or the spiral broccoli. It's the zucchini especially is a very mild flavor. You don't really taste it. So you use that's your non-starchy vegetable. And I promise you, I've tried in place of real rice because I'm a big rice. I love rice, love it. But I don't need the carbs in it. And so I've tried the cauliflower rice. And my husband cannot tell the difference. And neither can my 19-year-old son. So that's just certain ways that you can change out the pastas or the rices. And you don't have to do it yourself. You don't have to get a head of cauliflower and grind it and rice it and all that. They've got them in the freezer section now. All you do is pop them in the microwave and it's perfect. Okay. Boneless wings are fried, aren't they? Some of them are, yes. So you want to make sure that they are grilled, but you can always take the skin off and not eat the breading and just eat the meat off of it. And somebody's asking about what about shakes? Can you elaborate that for me? Are you talking about protein supplements, protein shakes? Are you talking about smoothies? Or kind of narrow that down for me and I'll be happy to answer that for you. Okay, so back to Applebee's. They also have a lot of chicken dishes, okay? They have a Bourbon Street chicken and shrimp. So it's grilled shrimp and grilled chicken. And you just choose the broccoli or the steamed vegetable. They also just have a grilled chicken breast. Most of the pastas are going to be off, of course, because it's pasta. They also have seafood there, and they have a blackened Cajun salmon. But that's what you would want to order, not the hand-battered fish and chips or the double crunch shrimp. They're all fried, breaded. You're more than welcome to order a hamburger. Just take the bun off. So there's all little ways of getting around it. Okay. You can also order any of the grilled salads. They've got a grilled Oriental chicken salad, a grilled Caesar salad, a grilled chicken tender salad. Um, they've got a strawberry balsamic chicken salad where it's got grilled chicken on top of it. Your strawberries would be a good carb, so that would be a little bit. And then you've got all the fresh veggies. And they also have a blackened shrimp Caesar salad. So tons, they've also got a Southwest steak Caesar salad. So tons of options on your salads. Then I thought we would go to Red Lobster. I don't have, they wouldn't print off the pictures, but basically rolls order everything that is steamed or grilled, not fried. Okay. But for like appetizers, you could order the lobster artichoke and seafood dip. Just don't eat it with the chips or the bread. You can order their jumbo shrimp cocktail. You could order that just for entree. So there's options there. Of course, the rolls or the biscuits aren't on there, but they have a ton of baked options. They have a ton of grilled shrimp, a ton of scallops. They have a seafood trio. You just have to make sure and tell them that you want everything steamed or grilled, not breaded and fried. So they have a ton of fish options and seafood options if you love that. And they have a huge menu. And I did also print off their kids menu. They do offer garlic grilled shrimp or a petite Maine lobster tail. So they have some options on the kids menu that are smaller. But also healthy. If you go to a barbecue place, you get the smoked chicken, you get this pulled pork. They have the sausage and cheese trays that you can get, where it's got the sausage and the cheese and the pickles. They've got the salads. Some of the best salads I've ever had used to be oh, it's not Rib Shack. It used to be downtown. It was a great barbecue place. It's closed now. However, they had the best pulled pork or pulled smoked chicken salad, and it was huge. And it was so good. And so normally when I go to barbecue places, that's what I get. Or I get just the sausage and cheese tray because I love that. And then I was trying to find pizzas, okay? Because everybody loves a pizza. I do know that here in Tupelo, we go to Fox's a lot, and they offer a crustless pizza. And so you can get, it's really just marinara sauce or their pizza sauce, and you can get all the proteins and all the toppings, all the veggies that you want. And it is so filling. It comes in a bowl about this big. It is so, I can't even eat all of it in one sitting. I can get half of it and then I have to save it for the next day. Be real careful if you go into pizza restaurants and they're offering the cauliflower crust. That does not mean that it's just cauliflower. It's still going to have some flour in it, and it's still going to be carbs. So occasionally, if you want a real piece of pizza, you get thin crust. It's the least amount, and you get it filled with your proteins. You get it filled with the veggies. Or when you order pizzas with your families, you just eat the top of it. A lot of times I do that because my family and I don't agree on the crust. But Tellini's is a really good option. That's one of my go-tos. I love their Greek salad. And they will give you shrimp on top of it. So you order the Greek salad with the shrimp, the grilled shrimp, and it's got a great flavor. But you can also get grilled chicken on it or grilled steak on it. Um, and that's kind of my go-to when I go there. They also have on the menu just meatballs, just the meatballs. No pasta with it or anything like that. So you could get an order of the meatballs with a side salad. Um, and you can do that anywhere you really go. Um, I had somebody ask me one time, she or he, I can't even remember, but what are they supposed to get like at Nukes when they go with their friends for lunch? Well, what would you normally get? Well, I would normally get the turkey sandwich. Well, you get the turkey sandwich and you just take the bread off and you get a side salad to go with it. Or you get one of their brothy soups with a side salad. Um, so as you start doing this and start kind of thinking about it, it's going to get easier. But now's the time to kind of start looking at that. I tell everybody where you start. Where do you start in this? 2 questions you ask yourself when you're about to eat something. Number 1, is this going to nourish my body? Because I want to put in good quality foods. Number 2, is it real? Did it come from the earth? Did God put it on this earth? Does it mean like if you go to supper tonight and you go to wherever you get the baked potato, or let's just say you go to Sonic and you get a hot dog and tater tots, and you ask yourself those 2 questions and you're like, no, probably not a great choice. Doesn't mean that you have to throw it away right then. Okay? That means you're actually thinking about it. And that means the next time you go out, you're going to think about it a little bit more and maybe make a better choice. Although everything Sonic wise is pretty fried. But be very careful too when you're in the grocery stores. Some of those frozen foods aren't the best. We don't want to get the Hungry Jack or whatever, because a lot of that is breaded. A lot of it has pasta in it. Just because it says heart healthy or low in carb doesn't mean it actually is. There are some brands that you can, like Quest. Again, here I go with Quest again. They have Quest pizzas in the frozen section. And they're really good and they're huge. You can get the frozen grilled chicken strips. You can get Atkins brand. And then there's also now Lean Cuisine. What was that called, Viv? What was the Lean Cuisine one called? Protein bowls. Lean Cuisine protein bowls. Atkins has the low carb living frozen meals. And so those are some options for like meals. But you always go to the grocery store. If you go to the grocery store, you choose your meat. You choose your good non-starchy vegetable. And you choose a good carb. Everybody want to know what the good carbs are? A real piece of fruit. Or if you do canned, you can do canned fruit. Just make sure it's in its own juice. You can do frozen fruit. Just make sure there's no sugar added to it. Okay? You can do starchy vegetables. That's a good carb. Like your potatoes. I don't care if they're white. I don't care if they're orange. I don't care if they're purple or yellow. You could do corn. And you can do like peas, like English peas. Okay? Half a cup. You can do those fresh. You can do them frozen. You can do them canned. Okay? You could also do starchy beans, like your refried beans, your black beans, purple whole peas, navy beans, white beans, everything except like baked beans. Baked beans are going to have added brown sugar, correct? We don't want that. Pinto beans. half a cup. Great fiber in them, great nutrients, vitamins, minerals, a little bit of protein in those, and good carbs. So those are real foods. Like I said, anything that expands in water, oatmeal, grits, pastas, rice, crackers, bread, those things are going to expand in your stomach too. And it's going to hurt because you are going to have a very small stomach. And so I don't want anybody to hurt. So any questions, specific questions? I never heard back about the shakes. I hope this helped. I hope this gave you some ideas of how to go out to eat, whether it's fast food or a chain restaurant or your local barbecue place, or it can be a 5-star restaurant. Protein, non-starchy vegetables, and a good carb. So why would white potatoes be okay instead of just sweet potatoes? I've heard in the past that diabetics could choose sweet potatoes. Sweet potatoes versus white potatoes. Sweet potatoes have a different nutrient makeup, okay, than white potatoes. But I can promise you, and I've tried it every way, if I eat half a cup of mashed potatoes, whether it's from a baked potato or a sweet potato, my blood sugar is the same, okay? So white potatoes still give you good nutrients. They've got a lot of potassium in them. The sweet potatoes have more of the carotene because it's an orange like carrots. So it's just different nutrients that you get. So no, I mean, the fiber in potatoes, which does help kind of, like I said earlier, kind of helps level out blood sugars. It's all in the skin, actually. The middle of the sweet potato doesn't just have more fiber than the white potato. The fiber part is all in the skin part. So I hope that answered that question. What about soup at Olive Garden? Yes, if it is a brothy soup. However, that's going to have pasta in it. But your cream bases, a lot of times they have added sugar and they have milk, of course. Now cream, heavy cream, if you've met me, I love me some heavy cream in my coffee. But they use cream and milk has carbs in them. And a lot of times in those like lobster bisques or things like that, they add sugar to them. So just be careful. You could get a small bowl with a big salad if you wanted to. That would be fine. Can you go over protein? You can. 60 to 70 grams of protein is basically the amount of protein your body needs to function. Okay, so that's why we have a minimum. It's not a high protein fad diet at all. So if you put it in perspective, 9 ounces of protein. Before you have surgery, we can go to Outback tonight and order a 12-ounce steak. Okay? Not to mention the appetizer, probably a piece of bread, the baked potato that we order with it, the steamed vegetables that we order with it, and the drinks. And so that's 12 ounces of protein that we're eating in one meal in a day. It's going to be hard for you, especially at first, to get 9 ounces in of meat in a day. And you're going to have to split that up over the day. So do some people go over 60 grams? Absolutely. Is it bad for you? No, because before surgery, we're eating probably, I mean, some people could be eating 2 to 3 times that amount of protein in a day. So 60 to 70 grams of protein. basically the amount of protein your body needs to function. If you lose weight, will your type 2 go away? So this is what's crazy about this surgery is it's truly a metabolic surgery, and it's the only one out there. Okay. So when I first came, I have my CDE. I'm a certified diabetes educator too, and I've been in dialysis and I've been in diabetes treatment center too over the years. And so I remember the first time I ever heard Dr. Pinson give the speech at pre-surgery education. It's a truly metabolic syndrome. Um, a lot of the times, now, if you have type 1, no, you will reduce the amount of insulin you have to take, of course, but it's not going away. Type 2s, though, a lot of times, of course, everybody that has diabetes that comes in for surgery, we consult diabetes treatment center. But I thought, oh my gosh, when they come back in 2 weeks or 6 weeks and they've lost some weight, their need for their medications for diabetes is going to go way down. And hopefully 3 to 6 months later, we'll be able to get them off any medications. A lot of times when you've been on just orals for your type 2s, like glucophage, glipizide, glucotrol, Januvia, Farxiga, any of those things other than insulin, we don't even send you home on those meds. We have you check your blood sugars for at least the first 2 weeks, and we give you a sliding scale. So if your blood sugar is over 150, you might take 2 units, but you don't even go home on oral meds. And some, I'm not going to say everybody, I mean, of course, nothing's 100%, but even if you come in on insulin, you go home on a sliding scale. Not half of your dose that you were on or anything. I mean, it's a sliding scale. So if your blood sugar is over 150 to 200, you might take 2 extra units. If it's 201 to 250. So we go over that with you, but as of the type 2 going away, yes, it can. And a lot of times it's immediate. It is not once you lose that weight. So that's what's amazing about this surgery. And research is saying now that truly with your type 2 diabetes patients, our surgery, the sleeve, should be considered as a treatment, just like glucophage is. Just like that's the first line of treatment is glucophage for everybody, metformin. Everybody goes on metformin if you've been diagnosed with type 2. But they're saying that now they see such a drastic change in people not having type 2 and not having those further complications with type 2 diabetes, because it is a progressive disease. And so as time goes on, you might have other problems with your kidneys, with your eyes, with your vascular system, and all that goes with it. It should be considered a line of treatment for type 2s. So that's really exciting. Have I answered all the questions so far? I never heard anything about shakes. I still don't know about the shakes. So if you want to ask that, any other questions we can answer? Am I seeing all the questions, Viv? Oh, can I live on the protein shake? No. No, I really don't want you to. I want you to be able to eat food. And if I don't mind occasionally, okay, I just don't want you to be dependent on the protein shake for your 60 grams of protein. Because a lot of times what happens, because we have preached and preached and preached and preached every time you come in here. Are you getting your 60 grams of protein? How are you doing that? What happens if we become dependent on them? We start telling ourselves, oh, well, I got my 60 grams of protein. Now I can eat whatever I want. And it's not about calorie in, calorie out. It's truly about the quality of the food that you put in. So if you're getting your 60 grams of protein every day by protein supplements, but then at your meals, you're choosing poor quality foods, pastas, breads, crackers, anything and everything, oatmeal, grits, rice, or anything to like chips and candies and cookies. We tend to eat what we taste, what we like. Okay. And you'll see weight gain. No. So what we don't want you to do is just get your protein in from protein shakes just for the sake of getting the protein in and then eating poor quality foods, because you will gain the weight back. You will gain the weight back. I can't get around it. Okay. So no oatmeal. Yes, no oatmeal. Oatmeal is not high protein. I don't care what it says on the package. Oatmeal is not real how the majority of us eat it. Meaning, if you want to eat real protein, real oatmeal, okay? It is the steel cut oats. You soak them in water overnight and you eat them like that. You don't add the sugar, the maple syrup, the peaches and cream, and you definitely don't buy microwavable oatmeal and open a package and put it in the microwave. That is not real oatmeal. Remember, the one thing when you're reading food labels, you look at protein and you look at total carbs, and you always want the total grams of protein higher than the total grams of carb. And it doesn't happen in any type of cereal, any type of granola, any type of oatmeal. Sorry to be the bearer of bad news. Okay, there was a ranch dressing question. So this is my take on ranch dressing, and most salad dressings for that matter. When you're buying it at the grocery store, any type of dressing that you like, turn the label around, look in the ingredients. If it has any sugar in it, any honey, any high fructose corn syrup, anything like that, you do not want to eat it. A lot of times I make my own ranch dressing because I'm a huge ranch dressing person. And so I get the dry pack mix and I'll mix it or make it with, it usually says 1 cup of mayonnaise to 1 cup of buttermilk. So I do half a cup of real mayonnaise because it doesn't have any sugar in it, with half a cup to maybe 3/4 cup of sour cream. And then I use Fairlife milk. And it's low carb, no sugar, and it's really, really good. So you have to kind of be careful, like your French dressings, your Thousand Islands, the raspberry vinaigrettes, those type things, they have a ton of sugar added to them. So you're really better to stick with oil-based. There's a great one out there, the Paul Newman's olive oil and vinegar. It has no sugar in the ingredients, and it's got a great flavor. Or if you like oil and vinegar, you just do olive oil and balsamic vinegar, or olive oil and the white wine, or olive oil, and lemon juice. So that's where you go with the ranch dressing and the dressings. Ranch dressing, buy the ones that are real, meaning don't get the fat-free or the low-fat because they've added a ton of sugar to it. So you just get regular ranch dressing or you make it yourself. I see one that says, in the beginning, how can you get all your proteins? Is that the same one? Okay, so let me answer this one first. In the beginning, right after surgery, how do you get in all your proteins? That's where the protein supplements come in. We have a ton to choose from that fall into our guidelines. When you come into your pre-surgery education day, we go over those. It's in the book. There's a list of them, and I go over those with you. Please, please, please do not go out and stockpile on your protein supplements right now. I actually tell you how many that you need to buy prior to surgery. So the 4 days prior to surgery, you will be on just your sugar-free, non-carbonated liquids, and you'll be on 3 protein shakes as meal replacements. And it's just 4 days, it's not 2 weeks. But I will tell you how many to buy, and I will give you a list of at least 10 or 12 that you can choose from. So you will be able to walk into Walmart, walk into Kroger, Dollar General even, and choose one. What was the other one? How long are you on a liquid diet after surgery? Okay, so how long are you on the liquid portion of the diet after surgery? It is 1 month to the day, or 5 weeks, I should say. So let's see, we had patients that had surgery on Tuesday, which was December the 1st. Okay, so you can either count 5 weeks. That would be to the Tuesday, or you can go to from December 1st to January 1st, and then you go to the next Tuesday. So it is 5 weeks. But that is all to heal. Okay, we've got to heal the inside suture line. So it's all about the healing portion. That's why I say it's a blip in the road. I'm not going to have you dependent on those protein supplements for the rest of your life. And by the time we get down to 5 weeks, you're ready for something to chew. You want to eat real food. You are tired of those protein shakes by then. And so at 6-week visit, I start weaning you off the protein shakes. And by about 9 or 10 weeks after surgery, you are off of them. You're eating real protein. I have what are quick breakfast suggestions since oatmeal and cereal are out. You can do boiled eggs. You can do turkey bacon, turkey sausage. You can buy those Jimmy Dean simple scramblers. It's got like eggs, egg whites, cheese, and all that. You put in the microwave. You can buy some Jimmy Dean's frozen. Let me see if I put them on here. No, but they do have some frozen egg bites. You can make your own little egg bites. Ton of recipes out there for that. You can do Greek yogurt if you just want to grab something and go. You can do tuna fish. You don't have to have breakfast. You don't have to have breakfast at breakfast. You can do deli meat wrapped around a piece of cheese. So those are some suggestions. You can also, I believe that the Fairlife milk is real milk. It's a real food. And so 1 cup of the Fairlife milk, not the chocolate, so sorry, but just the white, is 13 grams of protein. So if you like milk, I suggest you always switch over to the Fairlife, and it can be skim, it can be the 2% or the whole. And you can have that for breakfast. It's 13 grams. That's 2 of your 9 servings for the day. So you can always put some sugar-free chocolate syrup in it and go with that. They also have the P3 packs. Those are easy. Also, you've got these tuna creations, these packs. They've got all different flavors. One pouch is 18 grams of protein. This one, the honey barbecue, one pouch is 14 grams. So that's 2 of your 9 servings. And the lemon pepper, it's 17 grams, 2 of your 9 servings. And you can have real peanuts, real nuts. You can also choose walnuts, almonds. When you get out further away, and you're ready to maintain your weight loss, a great little breakfast. I do this when I do eat breakfast. I do like half a cup or so of the cottage cheese, and then I put just a sprinkling of just a few blueberries in there, and then I put walnuts in it. So you get your protein, get your fiber, and you get just a little bit of a good carb from your blueberries. But nuts are considered protein, so that's a good choice. Buttermilk. Buttermilk is going to be carbs. I don't think the Fairlife brand has a buttermilk. No, they don't. Yeah. So what I do for a buttermilk is I do the Fairlife milk with sour cream, and it kind of evens it out. Also, these are great. They have little rolled up deli meats around like a little rolled up cheese. This is the salami and the provolone. And 1 or 2 rolls. I'm sorry. Well, this one's kind of confusing. So it tells you on the serving size that the salami, which is 2 rolls, so it would be 2, is 8 grams, and with the provolone cheese for 2 rolls, it's 7 grams. So it's really a total of 15 grams. You eat 2 of these, 15 grams. Protein's a little peanut butter's a little tricky. However, this one's not so bad. But it's just going to be a little taste, because peanut butter, yes, it's a protein. I know everybody has said that. Pretty much every brand out there, like Skippy, Jif, All Naturals, doesn't matter. They add sugar to it, no matter what. And plus, 1 serving is 2 tablespoons. That's going to be a lot. But the Skippy is 2 tablespoons for 7 grams of protein. However, it's 6 grams of total carb, and there's 2 grams of fiber. So it's really 4 grams of total carb. So it follows my rule, doesn't it? It is more protein than carb. But I think it's really hard for y'all, especially after surgery, to get 2 tablespoons of peanut butter down for just 7 grams of protein. But, you could always, I remember when I was in high school, we used to go to Kermit's Bakery, and they had peanut butter milkshakes. Now, we're not going to do milkshakes, but you could do a vanilla, like Premier Protein, and you could put maybe a tablespoon of this in there, and you can have a peanut butter milkshake. So you can always alter those flavors. Caffeine water, as long as it's not, is caffeine water okay? For the first 2 weeks after surgery, we really don't want y'all to do any type of caffeine like that. Caffeine works as a diuretic, so it's going to pull fluid out. And really, at first, we're especially trying to put the fluid in. However, so you want to do like decaf coffee and decaf tea. I'm not a big fan of like, well, not going to go there. So for the first 2 weeks, you do want to kind of avoid that. But if you come in to me at your 2-week visit, post-op visit, and you're getting all your protein and all your fluid in with no problem, I will give you back your caffeine. Okay, so at 5 weeks, you get to start stage 3. That is when we start soft textured proteins. You are still doing all of your protein, though, 60 grams from your protein supplements, because it does not take very much. You might get 2 bites in and you're going to be full. Stage 3, I tell everybody, it is reintroducing foods after not having anything solid on your stomach for about 6 weeks at that point. It might take 2 bites. This is when you have to practice the chewing. So you're going to want to chew your food 20 to 30 times per bite, applesauce consistency before it goes down. This is when you want to practice slowing down. You want to put your fork down between each bite. You want to wait a couple minutes because if you eat fast, it's going to make you sick. This is also when you start having to separate your fluid from your food. You cannot drink when you eat. So you have to stop drinking 15 minutes prior to your food, and you don't pick it up to 30 minutes after. So it's hard just to get those 2 to 3 bites in. But I want you to think of it more as practicing. So I do want you to eat your bites at that point of real protein at breakfast, lunch, and supper. So you can practice stopping and starting that fluid. But I don't want you to be so overwhelmed that you're trying to count all grams of protein, because you're not going to be able to get 60 grams of protein from the food at that point. You're not physically going to be able to do it and get your 64 ounces of fluid in. So I kind of take that pressure off of you. And that is soft textured, like scrambled egg texture. So you can have eggs, you can have cheeses, you can have the cooked slightly mashed beans, you can have the tuna fish or the chicken or salmon. You can have any type of grilled or baked fish at that point. And then when you come back at your 6 week, we continue to add textures to those proteins, and that's when I start weaning you off your protein supplement. Any other questions? I think I've answered all of the ones I see. Okay, well, perfect timing. That was 1 hour. I hope y'all learned a lot. Just know that we are going to walk you through each stage when we are there. If you have not met me yet, I love some handouts. And I go over those handouts with you. So you're always going to know when we're in that stage what you should do. So do not hesitate to call us if you do have questions. Thank y'all so much for coming on. And we will see y'all soon. Y'all have a Merry Christmas if we don't see y'all before. Thanks.